from Brenda is also negative. And these people have been tested twice just to prove, and twice over a period of time, not just twice on the same day. So we are pleased. We are very, very, very pleased that this is the circumstance of the day. Having said that, I would also, on the flip side of that, is to announce that over the last 24 hours, we have tested over 300 Kenyans. Out of those, 22 have been tested as positive. This is the largest number that we have received in a single day. It is also commensurate with the fact that it is the largest number that we have tested also in a single day. Out of those 22, 13 are male and 9 are females. Let me also add that 21 out of the 22 cases are people who are currently in quarantine. And that tells you the importance of the exercise that we have been carrying out. And that it is lucky that we have found the 21 people in quarantine, because by now the 21 would also have passed it on to other people. And one case is in Mombasa Hospital. You'll be getting the statistics on all this in the leaflet that we are going to give you. There are 18 Kenyans, 2 Pakistanis, and 2 people from Cameroon, 2 Cameroon nationals. And that makes up the number of Kenyans we have now. In terms of country of origin, now please note, these are not people who are in those counties. These are not people who have been tested in those counties. And these are people who have not arrived in those counties because they are in quarantine. And they are quarantined as they came through the airport. So Kakamega County, the residents are as follows. Kakamega County, 1 resident. Kiambu County, 2 residents. Kilifi County, 1 resident. Machakos County, 1 resident. Mombasa County, 7 residents. Muranga County, 1 resident. Nairobi County, 1 resident. Nyamira, 1 resident. And international, the 4 that I have said, from 2 each, from Cameroon and from Pakistan. Ladies and gentlemen, fellow Kenyans, over the last 24 hours, 810 Italians have passed away. During the same period, 812 Spanish people have passed on as a result of the coronavirus disease. What this tells us is that we cannot emphasize enough what is likely to be ahead of us unless and until we adhere to the rules that we have established. Distancing, washing hands, and observing strictly what the government is saying. I would also like to add here that this disease knows no boundaries, not national boundaries, not political boundaries, not between rich and poor. We are all affected in the same way. And that is why I would like to persuade our leaders in and out of Parliament that tafadhali, when you speak to this issue, don't speak in a manner that brings division. For example, the acting DG is misquoted today, and he'll speak for himself. as having said that he didn't know that there was a multi-agency activity going on, as if there is a division between the arms of government. I would like to state very, very clearly, there is absolutely no difference. This is a total government effort. The leader of all of us is the president, who is guiding us through this whole process. The transport ministry is involved in matters transport. The police and the security authorities are involved in tracing. When it comes to tracing of contacts, and we are tracing thousands of them now, when it comes to tracing of contacts, the Ministry of Health does not have the capacity to trace contacts. The Ministry of Health accompanies the agencies that are assisting the Ministry of Health to trace the people. So if you get a visit from another arm of government, then you cannot say, that is not to say that the agencies are not working together. As a matter of fact, that is a demonstration that the agencies in government are all working in unison and in a manner that indeed has not happened in a long time. We are working very well together. So it is not true to insinuate that there might be gaps or differences. There is not, and there is none. I would also like to say, this morning when Brenda and Brian were talking to Kenyans, they also emphasized the same. And they said that they were grateful to the government, and the president especially thanked the little girl called Brenda, because she is the one who brought herself to Bagathi, and because of her, we have been able to track and quarantine people who now have been spreading the virus. So I would just like to say, and to echo her as a hero, as a Kenyan hero, to say if everybody took similar responsibility, quarantine yourself if you know you have traveled, because so many cases are out of people who traveled, who are asked to quarantine themselves, and they did not. And just because they are not feeling well, they decided they have they don't have the virus. So I would like to urge, please quarantine yourself if you have been traveling. Quarantine yourself if you begin to feel that you are not feeling well. Quarantine yourself until you get help, or at least until our officers are with you. Finally, ningetaka tu kuzungumza kidogo mambo ya hao Wakenya wawili ambao leo hii daktari amesema wako sawa kabisa, wamepona na wako katika pale walitoka, wako kwao nyumbani. Na tunashukuru Mungu kwa kutuhurumia kama Wakenya, kuhurumia hao watu wawili, na tunafurahia hiyo maneno. Rais mwenyewe alifurahia hiyo maneno sana leo katika na kuzungumza na hao wawili katika mkutano wa video, na vile vile Wakenya wengi wamesema vile wamefurahia hiyo maneno. Lakini hii ni kusema nini? Ni kumaanisha ya kwamba tukifanya vile serikali inataka, tukifuata maagizo, maelekezo ya serikali, basi ienda ikawa tunaweza kusaidia Wakenya wengi, tunaweza kuokoa watu wengi ambao ienda wakafa, kwa sababu hii virusi iko hapa. Hii virusi inaua watu wengi sana katika hii dunia. Tangu wakati huu watu karibu 12,000 wamekufa kwa sababu ya hii virusi. Kwa hivyo sisi tukiona vile watu wanaangamizwa huko Ulaya, sisi pia ni lazima tujikinge. Tafadhalini wenzangu, ni lazima tujikinge ndio tusifike hapo pahali ambapo kila siku tunasikia watu 800, watu 900, watu 700 wamekufa. Jameni, washa tufuate maagizo ya serikali, tusije tukafika hapo. So I want to thank you all very, very much, and just add that as on the matters of coordination of government and on the issues of taking care of the wananchi, that food trucks, just like CS Munya said yesterday, that we have not stopped commerce because of the curfew. Food trucks are free to move in the evening, and the police have been advised the same. There are also vehicles moving across the border. For example, vehicles moving food and other items and medicines from Mombasa, the port of Mombasa, heading for neighboring countries. You know, so that is still going on. What we are avoiding is contacts in the evening in a manner that can reduce social distancing. So I am thanking those who are continuing to observe the curfew. I am thanking those employers who continue to release their people on time. And I am thanking those employers who continue to support, you know, Kenyans and employees who have supported the companies that they work for many years and for a long time. I'm also thanking the business community for being part of this effort to support government. I am thanking the donor community, the World Bank, the World Health Organization, UNEP, UNON, and all the others who are working with us, the Clinton Foundation, and all other organizations that are currently working with us to increase the supply and readiness for what we can see coming at us ahead. So I am just asking for unified effort and to say that Kenyans, when you are in a ship that is going towards a storm, you don't start arguing or fighting within the ship. You get together to hold on so that you can weather the storm. I thank you.
Okay. I am Mark Namasa from KTN News. I have two questions. One is about the report that we got yesterday concerning the
Mark,
clinical...
you have to speak a bit louder.
Yes. Okay, I'm Mark Namasa from KTN News. I have two questions. One is about the clinical officer and the spouse that we got information yesterday that they had been tested positive. And number two, the issue of water in city estates, given that this is a critical commodity in the fight against COVID-19. What happens to city estates that don't have water, like, what is this called? Yeah.
Okay, I'm going to respond to one of them, which is about the water in the city, and leave the other one to Dr. Amos to respond during his technical response. As far as water is concerned, there are three things happening in the city. One of them is that we are aware that there are very many private sector people, including the Kenya Pipeline, that is working towards supplying of water, particularly in populated areas. That's number one. We have also asked that we are also aware that the national government, through the Ministry of Water, is supplying tanks, is supplying water points, again, in almost everywhere, including the highly populated areas. We have also asked that at this time when people are going through the kind of difficulties that they are going through, that people should not be disconnected because of water bills. So if there are people being disconnected because of water bills, we have asked the city not to disconnect water to people because of water bills. If there is a shortage of water because of a burst pipe or something, that is a different matter and is an issue that can be handled and repaired. We are also asking KPLC. We are not saying that if you are able, you don't pay, but we are also asking KPLC, tafadhalini, when people delay a little bit paying, mutuonee huruma jameni, muonee wananchi huruma, so that you can also, ease the pain that they are going through. We are also saying, Mark, not to sideline your question, but just to ride on it, is we are also saying that even those in food distribution, not to take advantage of wananchis by increasing food prices when they don't need to. And as I said earlier, when it comes to certain things like food and medicines and sanitary products, also sanitizers, we have said if you increase the prices, we have got a method of dealing with that. It's oversupply. When sanitizers became too expensive, we oversupplied, even giving them for free, so reducing the price. So we are saying food movement is allowed even during curfew. So there is no need for food prices to go up. I will let Dr. Amoth respond to the issue of the clinic officer.
Thank you, Waziri. Let me start by clarifying again and re-emphasizing that at no point did the office of the DG insinuate that there's no multi-agency approach in the fight against COVID-19. Indeed, we have emphasized over and over again the multi-agency and the whole society approach in this fight. Regarding the case of the clinical officer who is currently admitted at the isolation disease unit in Bagabi, yes, it is true that this healthcare worker attended to a patient who had traveled from Nigeria and later developed symptoms and was quickly screened and tested and of course turned out positive. She is responding very well to treatment and we are hopeful that she'll make a full recovery like the 2 cases that we have reported today, this morning. Thank you.
What is the word, sorry? Current condition. Okay, I can respond to the issue of the French national. The French national did go back to the country, and there are also evacuations, as you are aware, of other people from the country, from other nationals who are also evacuating to their own countries. I'll give you a chance. Yes. No, sorry. You can respond to me.
Okay.
Yes, please. Sorry? Thank you very much. On the issue of the face masks, not all face masks that are being made are worth anything. I suppose it's better than nothing. It prevents dust. It prevents dust from breathing dust. But the truth is, the matter is that we now have capacity of making approved masks in the country, face masks. I know that Kitui, the Kitui women's, what is it called? Kikotech in yesterday, I know that Kikotech was approved to make face masks in the country, but we shall continue to make as many as we can in the country, but also add whatever we can from the country. We are also getting donations from elsewhere around the world. So I'll let my colleague answer that one. As far as the budget is concerned, we are looking at all avenues of funding, of moving monies to be able to fund this issue. including how to support the vulnerable groups and vulnerable people in the country. We have not currently, reallocated any specific budget, and we are not looking at any specific budget for allocation. Now, when it comes to a crisis, there is no budget that cannot be reallocated. I'm just saying it has not happened, as far as I know, because we have had sufficient support from the international community. The government itself has put in its own money, and we continue to get support from various quarters. Only yesterday, the World Bank was approving a line today. Is it today, the 2nd of April? Is tomorrow? Is it tomorrow? 2nd of April. I've lost track of yeah, tomorrow they are approving a line of credit of another $50 million. So it is not that we have ran out of money for this purpose. The problem globally is shortage of materials, not really money. At the moment, the world over, the problem is shortage of materials. Let me let my colleague also respond to that particular question.
Thank you, Waziri, again. All the patients are doing well, except one who is in the critical care unit at the Aga Khan University Hospital. But his condition is also improving. Indeed, in the next 2, 3, 4 days, we should also be able to come back to you to announce that potentially there's another patient who could be declared as having been cured of COVID-19. So all the patients are doing well. It's only one who is in ICU on ventilatory support, but is responding very well indeed to treatment. And we are in constant touch with our colleagues at Aga Khan Hospital to monitor his progress as he undergoes his treatment. Thank you.
Final one, please. Sorry?
Whether their members are fully, adequately equipped with the knowledge on how to handle this virus. And then again, they were talking about lack of adequate protective gear for their members. So they were asking what the government is doing in terms of just assuring the members of their safety. Yet in the recent past, through the press conferences, you've been telling us that we are fully equipped, and then those on the front line are fully equipped with the gears, protective gears.
Thank you.
What do you have to say about that?
Thank you very much, Gloria. Two things. Number one is that we will not expose our medical workers. And at the moment, anybody facing any patient, any suspect, anybody going to do any tracing is in medical gear. The shortage, of course, the global shortage of PPEs has also been a problem for us. But I am also glad to say that probably by end of day tomorrow, we are also going to start manufacturing PPEs here in Kenya. So that is going to deal is going to be a breakthrough for us. We are just waiting for the approvals because of the material that is required for doing so. But once that happens, then even the shortages we are experiencing because of global demand are also going to reduce. So our intention is to make sure that they are properly protected. Now, as for training, let me tell you something. We have got extremely well-trained nurses. Extremely well-trained nurses in this country. And therefore, the training we are talking about is not from square A. We are simply talking about them being training for adoption to this particular disease. They have been dealing with very many other infectious diseases, particularly TB, as you are aware. So it's not the first time that our people are dealing with a challenging state. So, as I conclude, let me just say to Kenyans, 81 of us are now positive. 81 people. Growing that exponentially, if you have one person affecting so many people, then you can understand that there is a very high chance that the person next to you has also been exposed. Keep your distance. Thank you very much.
Excuse me, sir, kindly. Allow me to ask this one question, kindly. My name is Purity from KBC. You began your statement by saying the virus is widely spreading in the country. That means there is no breakthrough into controlling this. And we've seen from even China or even other countries that have had rapid spread of this virus calling for a lockdown when such cases are experienced. Maybe you can tell us what's the plan for the country. Number two, for the people who are recovering or receiving treatment, what mode of treatment are you using for these patients?
Let me oblige you by saying that, you know, we will take, as the president said this morning, there is nothing that is not on the table. But there are certain very serious preparations. Before you take a step, you need to prepare substantially for any step that you want to take. And we will not make steps irresponsibly, so to speak. We owe a responsibility to Kenyans, particularly those in vulnerable areas and particularly those in vulnerable groups, to ensure that we protect them under any circumstance. So let's just put it this way. Let's say that as we watch the situation and what we have seen, Kenyans should prepare themselves for stiffer measures that the government is going to take, because we cannot, as I said earlier, we cannot behave normally in an abnormal situation. Let's observe, for now, let's observe what we are supposed to observe seriously. And let me also say this. You can go into a so-called lockdown and just be speaking about it. If you lock down people, 10 people in a room, and you have got one infected person, and you are talking about locking those people in, all you are doing is spreading the virus amongst those ones that you have locked in. So you must think through, you know, what you are doing. And every country has got different circumstances and act differently. If we do what we are supposed to do, lockdowns come because people are not doing what they are supposed to do. Because if you are keeping social distance, if you are keeping away the distance you are supposed to, then it will not be necessary. But it becomes necessary because that is not being done. I'll ask my colleague to answer the other question.
Thank you once again. This being a viral infection, there's no specific treatment. The treatment we offer as clinicians is basically supportive treatment. Supportive means we respond to the symptoms that you exhibit as we take care of you. Like if you have a fever, we give you something to bring down your fever. If you are coughing, we give you something to suppress the cough. However, there are very many trials that are being undertaken as we speak. And the most quoted is, of course, the use of hydrochloroquine and an antibiotic called azithromycin, which is locally available. So all those medicines are at our disposal to be able to deploy for cases which require them. For example, the current patient who is admitted in ICU in Aga Khan is actually on chloroquine and azithromycin and is making good progress. But because this is just a single statistic, we cannot be able to say that chloroquine and azithromycin works for COVID-19. We require a bigger sample size so that it can be statistically significant for us to say this treatment works for COVID-19 and this one does not work. Thank you.
Sensitivity is a short, sharp pain that people experience when they have something hot or cold getting to the nerve of the tooth. Dentists recommend Sensodyne to their patients. It's able to get inside the tooth and calm the nerve of the tooth down. And the proof's in the results. It works.
Niaje wa Kenya, hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water. Apply a small amount of soap. Rub palms together. Rub fingers and thumbs and the bits in between. Rub nails on palms. Rub the back of each hand. Rinse with clean running water and dry thoroughly with a clean dry towel.
Furthermore, it is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
Looking to enjoy sumptuous meals and drinks at affordable rates? Welcome to Nascos. Our diverse menu gives you a variety to choose from. Visit us at Veteran House 4th floor, Moi Avenue, or along Mombasa Road at the Nation Printing Press Center. We offer outside catering service and do home and office deliveries. For inquiries or to place an order, call 0700-613-902 or email info@nascos.co.ke. Mission Staff Consumer Society Limited. Enjoy our hospitality.
Niaje wa Kenya, hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water. Apply a small amount of soap. Rub palms together. Rub fingers and thumbs and the bits in between. Rub nails on palms. Rub the back of each hand. Rinse with clean running water and dry thoroughly with a clean dry towel.
Furthermore, it is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
Jonah is terminal. It's his dying wish to see his father on top again.
There's an operation that can save Jonah, and I need the money. Let's call it a new beginning. A race, to be exact.
It was his idea, the whole thing. He's got a real creative mind.
Who will I be racing against?
Know who? It's called geocaching, Reese. It's real good fun.
You are lost.
And the course?
Ohio.
Heaviness and a burning inside. It could be heartburn.
Indigestion and heartburn? Eno gets to work in 6 seconds and works on the 6 symptoms of heartburn so you can keep living life non-stop. Eno, fight heartburn and indigestion fast. Protect yourself against coronavirus by using Amara antibacterial hand sanitizer that will effectively clean your hands and eliminate disease-causing virus while you're on the go.
Niaje wa Kenya, hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water. Apply a small amount of soap. Rub palms together. Rub fingers and thumbs and the bits in between. Rub nails on palms. Rub the back of each hand. Rinse with clean running water and dry thoroughly with a clean dry towel.
Furthermore, it is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
PesaLink is the cheapest way to send and receive money instantly into your bank account anytime, anywhere. Use PesaLink today in 3 easy steps. Step 1. Select PesaLink on your bank app or USSD. Step 2. Select either send to phone or send to account. Step 3. Input the phone number or account number to send money to and confirm the transaction. PesaLink. Easy, affordable, instant.
Je, maumivu ya kichwa na kukosesha amani? Kaluma Strong hutuliza maumivu ya kichwa, maumivu ya mwili na hata huondoa joto jingi mwilini. Kaluma Strong ina aspirin kama kiungo. Maumivu yakizidi, muone daktari.
This is NTV.
Hujambo mtazamaji, natumai ubuheri wa afya. Karibu kwenye NTV Alasiri. Jina langu ni Nuru Abdul Aziz. Idadi ya watu wenye virusi vya corona hapa Kenya sasa imefika 81 baada ya watu 22 zaidi kupatikana na virusi vya COVID-19. Habari njema ni kwamba watu 21 kati yao tayari wamo karantini, hivyo hawezi kueneza maradhi hayo kwa watu walio nje. Na mtazamaji, taarifa hiyo tutaipata hapo baadaye, lakini tukiendelea na taarifa zetu, kutokana na hali ngumu ya uchumi ambayo imeanza kushuhudiwa hapa nchini baada ya masharti kutolewa katika juhudi za kukabili kuenea kwa virusi vya corona, Wakenya wengi wana wasiwasi mkubwa kuhusu namna ya kulipia kodi za nyumba. Mapema leo chama cha wenye nyumba na wapangaji nchini kimeitaka serikali kuwa na mikakati ya kuwapunguzia gharama wenye nyumba ili wawaondolee wananchi kodi za nyumba kwa miezi mitatu.
There should be a waiver for rent for the months of April, May and June, so that this common mwananchi can actually work on putting food on the table. Right now, I wonder if you have, let me say 10,000, 3,000, 4,000, 20,000 for rent. Are you going to buy, to pay for the rent, or you're going to make sure that your children have food on the table? So we are demanding for the government to come out straight and put this forward so that we can have at least a reprieve on that. What we are saying is this, that the government should come up with a compensation package for the landlords. Now, we know very well that most landlords are actually servicing their loans, and they depend on the rent for them to service their loans. The government should come out and give them a 6 months moratorium so that at least they can have that humble time also to put food on the table.
Na wakazi katika mtaa wa Embakasi, Mashariki, kaunti ya Nairobi wamesihi serikali kuangazia hali katika vitongoji duni ili kutoa hamasisho kwa wakazi wa mitaa ya mabanda kuhusiana na homa ya corona. Hata hivyo, wakazi hao wanasema ingekuwa vyema serikali kutoa msaada wa maji safi na sabuni pamoja na barakoa za kukinga wakazi ili kupunguza uwezekano wa maambukizi ya virusi vya corona katika mitaa hiyo duni. Wakati huo wanasema amri ya kutokuwa nje usiku imeathiri sana maisha yao katika mitaa hiyo, ikizingatiwa kwamba wengi wao wanategemea kazi za jua kali na vibarua au biashara rejareja.
Kitu ya kwanza tunaambiwa tukae nyumbani, hatujakataa. Lakini ile swala yenye tunauliza serikali tushughulikie ni moja. Vyakula. tutakula nini tukikaa nyumbani? Na sisi ni watu lazima tuende kibarua kila siku tukitafuta mapeni hapa na pale.
Sanitation government inafaa tuletea hata gloves, mouth gear, ama sijui zinaitwaje, face mask, tukue safe bana.
Kwingineko, shirika la Msalaba Mwekundu tawi la Kenya kwa ushirikiano na kamati ya kimataifa au Msalaba Mwekundu ICRC linafanya kazi na idara ya huduma za magereza humu nchini kuzuia kuenea kwa COVID-19 magerezani. Mpango huo unalenga magereza 48 ya wanaume, wanawake na watoto, ambapo wanatengenezewa vifaa vya kunawia mikono, kupewa sabuni na jeli za kusafisha mikono, mbali na kupewa mafunzo maalum kuhusu COVID-19. Aidha, wafanyakazi wa magereza wanahamasishwa kuhusu COVID-19, dalili za homa hiyo na njia za kujikinga au kushughulikia mwenye ana dalili hizo. ICRC vile vile inashirikiana na idara ya afya magerezani kuweka itifaki za kushughulikia visa vya COVID-19 magerezani. Miongoni mwa hatua hizo ni njia za kudumisha usafi na kupima viwango vya joto, hasa miongoni mwa wafungwa.
So it's the first batch. Of course, we realized by working together there's a need to really increase the number of screening points, and so we'll be happy at the International Committee of the Red Cross to further support the Kenya prison service with the needy construction protective material for doing so.
We have done a lot of work in the prisons around the country, especially in terms of sensitization and trainings for the prison staff and also the inmates, provision of hand washing facilities and including soap.
Na tukirejea taarifa yetu ya awali, idadi ya watu wenye virusi vya corona hapa Kenya sasa imefika 81 baada ya watu 22 zaidi kupatikana virusi vya COVID-19. Habari njema ni kwamba watu 21 kati yao tayari wamo karantini, hivyo hawawezi kuwaenezea watu walio nje.
Over the last 24 hours, we have tested over 300 Kenyans. Out of those, 22 have been tested as positive. This is the largest number that we have received in a single day. It is also commensurate with the fact that it is the largest number that we have tested also in a single day. Out of those 22, 13 are male and 9 are females. Let me also add that 21 out of the 22 cases are people who are currently in quarantine. And that tells you the importance of the exercise that we have been carrying out. And that it is lucky that we have found the 21 people in quarantine, because by now the 21 would also have passed it on to other people. And one case is in Mombasa hospital. You'll be getting the statistics on all this in the leaflet that we are going to give you.
Na mgonjwa wa kwanza wa corona hapa Kenya, Brenda, na mtu wa kwanza aliambukizwa homa hiyo, Brian, wamejitokeza hadharani leo kama watu waliopona homa ya corona na kupata fursa ya kipekee ya kushauriana na Rais Uhuru Kenyatta kwenye mawasiliano ya televisheni. Wawili hao walitumia fursa hiyo kuhimiza Wakenya kutii maagizo ya kuzuia kuenea kwa homa hiyo ya corona. Brenda Ivy Cheruiyot na Brian ni miongoni mwa wagonjwa watatu waliopona COVID-19 hapa nchini.
So indeed, we are celebrating today despite the challenges that we continue to face, your bravery. But more importantly, your patriotism in recognizing that you had a responsibility not just to yourself, but to your country, to your neighbors, to your family, to your friends. As a result of that, you are able to limit your contacts with other people. You were able to identify the people who inadvertently you had been in contact with, who were able to trace. And there is not one single death that can be attributed from your infection. You're a very brave and wonderful girl, Brenda, and we celebrate you for that, and we are grateful to you.
I think I may have contracted the virus in London or on the plane back to Nairobi. So after landing in the country, I had a cough 3 days into landing in the country. So when I suspected they might have been something, as a responsible Kenyan citizen and a patriotic Kenyan, I decided to watch the response of my body for 1 day. And then the next day, that is when I presented myself to Mbagathi Hospital, because I saw on when I was in the US, I had seen something about Mbagathi Hospital having an isolation center. That's why I went to Mbagathi. So I think that was very useful, the information I saw, because at least it helped me know where to start. Because the nurses were also, I think they were also, you know, under some pressure because it's the first patient, they have not seen this before, but they were really nice, they were very supportive, the doctors as well, and the cleaners who came to clean my room. They used to talk to me a lot because sometimes I was very emotional, but I would like to assure everyone, all the Kenyans, that this is something that can be managed. It's treatable, and sometimes you may show very, very mild symptoms, just a cough and a headache, but when you see that, you're supposed you know, as a responsible Kenyan citizen, you should contact the authorities and tell them, I'm not feeling well, this is how I'm feeling, and be, you know, come forward and be confident, because they're going to treat you and they're going to do everything for you.
I got the virus from contact with Brenda over here. I got it from the community transmission, what the ministry is calling that. So immediately, Brenda's results came back. I'd like to thank the government, your government, because they reacted very fast. They came for me wherever I was. They took me to a government facility, and I was tested, and immediately the results came back as positive. The government, your government again, embarked on treating me for the past 2 weeks or so. And as a result of that treatment, I've recovered. I'm feeling much, much better now, like I was before.
Mbali na hayo, kaunti ya Taita Taveta imeweka mikakati kabambe kujitayarisha kupambana na virusi vya korona endapo kisa chochote kitaripotiwa eneo hilo. Kaunti hiyo inayopakana na taifa la Tanzania vilevile imechukua tahadhari ya kukinga wenyeji dhidi ya maambukizi kutoka nje ya nchi. Mwanahabari wetu Bilotieno anatujuza zaidi.
Na shukrani kabisa mtazamaji, niko katika hospitali ya rufaa ya Moi mjini Voi, kaunti ya Taita Taveta, na tuwafuatilia swala la janga hili la corona ambalo limekuwa likisambaa kwa kasi. Kaunti ya Taita Taveta imeweza kujiweka katika kipao ama katika mkondo wa mbele katika hali ya kutatua ama kuzingatia masuala ambayo ama mikakati ambayo imewekwa ili kukinga wananchi na pia maafisa wa afya katika hospitali zile zilioko Taveta, Undanyi na Mwatate na pia hapa Voi. Na kwa sasa najiunga na daktari ambaye yuko hapa kando yangu na ataweza kutujuza mengi zaidi.
Tuko na isolation center, tukianzia upande wa mbali wa Taita Taveta ambao ni Taveta sub county. Tumeweza kuweka quarantine ya capacity ya 100 sitting bed ambayo iko pale MTC Taveta, na pia tumeweza kuweka isolation ambayo iko pale Rekeke Health Center, na inavyo pia hivi vifaa vya kuweza kujizuia kupata maambukizi ya corona. Tukielekea upande wa Mwatate, tumeweza kuweka isolation center ambayo iko mahali pale hospitali ya Mwatate Sub County Hospital, na tumeweza kutayarisha bed capacity ya 12 zikiwa 12, zikiwa 6 kwa wanawake na 6 kwa wanaume. Na vile vile pia kwa upande wa self holding room tumeweza kuhimiza zahanati zote zihakikishe kuwa kuna room kando imewekwa ya kutenga iwapo mtu ana zile dalili za kuwa na hiki kirusi cha corona, ndipo madaktari wanaweza kuenda na maybe kumhudumia zaidi na kujua kama atahitaji isolation.
Mgonjwa akikuwa screened, tukipata yule mwenye
anafikia ile tunaita criteria, akona zile dalili za COVID-19, basi tunamweka kando na simu itapigwa. Ile rapid response team itakuja kumchukua ule mgonjwa pale pale kwenye atakuwa amewekwa, ili asikaweze kutangamana na wengine huku katikati ama ndani ya hospitali. Tutamchukua pale, alafu tutamleta kwa screening room yetu. Pale katika screening room tutamchukua tena temperature, alafu tutamuuliza maswali tena zaidi, tuone kwamba anafikia ile criteria. Basi tutachukua ile sample kutoka kwa ule mgonjwa, alafu tutanotify, tutapiga information katika sub county level. Ile information itaenda mpaka kule Nairobi.
Hawa ni baadhi tu ya maafisa wa afya katika kaunti hii ya Taita Taveta, na kama ulivyosikia ni kwamba walisema wako tayari kuweza kupigana ama kuweza kukabiliana na yoyote yule ambaye atakuwa ametokea ama atakuwa amejitokeza ambaye atasema ameweza kuathirika na virusi vya corona. Ikumbukwe kwamba kaunti hii ni kaunti ambayo inapakana na nchi jirani ya Tanzania, na hapo awali kulikuwa na hofu kwamba kunaweza kuwa na watu ambao wanavuka kutoka nchi ya Tanzania wakiingia Kenya, na pia kuna ule mvutano ambao kuna wengine ambao ni wanabiashara wanavuka kutoka Kenya wakielekea nchi ya Tanzania na kurudi. Hizo ni hofu ambazo kaunti hii ya Taita Taveta ilikuwa nayo, na kulingana na sekta hii ama maafisa wa sekta ya afya katika kaunti hii wanasema kwamba wako kidete ama wako tayari kukabiliana na yoyote ambaye atakuwa amejitokeza ama yoyote ambaye atakuwa ameathirika na virusi hivyo vya corona. Mtazamaji, ni wewe ukae pale nyumbani na tutakuwa tunakujuza yote katika habari zetu za utendeti za NTV, na kurudisha katika studio zetu za Nairobi.
Naam, shukran sana Bill Otieno. Mwenyekiti wa kamati ya afya katika bunge la kitaifa Sabina Wanjiru ameiomba serikali kutoa fedha zaidi za kununua vifaa vya kukinga watu virusi vya corona na kadhalika kutoa bima maalum kwa watu wote wanaofanya kazi za kukabili COVID-19 pamoja na familia zao. Akiongea Murang'a wakati wa kusambaza barakoa zilizoundiwa humu nchini kwa wahudumu wa bodaboda kaunti ya Murang'a pamoja na kutoa matangi ya maji kwa wakazi, Sabina alisema bima maalum itawapa ushujaa zaidi wahudumu wa afya. Sabina ambaye vile ni mwakilishi wa wanawake wa kaunti ya Murang'a anahimiza kaunti kutoa fedha zaidi za kuajiri wahudumu wa afya ili kuimarisha juhudi za kudhibiti COVID-19.
Kwa hivyo ombi langu kwa serikali ni kwamba zile nguo ambazo ni protective gear za wale wafanyikazi wa afya ziwe kwa wingi na tuwakinge na tuangalie zile insurance zao ili kuhakikisha kwamba mwenye ambaye kwa bahati mbaya anaweza shikwa na ugonjwa katika laini yake ya kufanya kazi, serikali itachukua malipo yote ya hospitali na wampatie insurance na wakinge pia familia zao.
Na kwenye taarifa za michezo, mshambulizi wa timu ya taifa ya soka nchini Harambee Stars Michael Olunga anaichezea timu ya Kashiwa Reysol katika ligi kuu nchini Japan amezungumza na NTV Michezo kwa njia ya kipekee kuhusu maisha ya karantini na njia za kufanya mazoezi wakati huu wa janga la homa ya corona.
We have been given a routine by the club physios. They've given us a home workout plan, so we are following this workout to keep us fit, because we still don't know when the resumption of the league is going to take place, so we have to stay focused and stay fit. But all in all, I'd just like to urge all my fellow athletes and everybody around the world to try and take this virus quite seriously, and to try and take the steps that the WHO, UNICEF has given each and everyone to try and combat this deadly virus that is affecting everyone around the world. So as at now, we just work from home, try to keep the level of the fitness and body conditioning until when we are going to resume. But otherwise, just want to urge everyone to stay safe and be blessed. Chop.
Aliyekuwa rais wa klabu ya Marseille ambao walikuwa mabingwa wa zamani wa ligi ya Ufaransa, Pape Diouf ameaga dunia. Diouf amefariki akiwa na umri wa miaka 68 baada ya kuugua homa ya corona. Diouf ambaye ni mzaliwa wa taifa la Chad alikuwa na uraia pacha wa mataifa ya Ufaransa na Senegal na aliongoza Marseille kutoka mwaka 2005 hadi mwaka 2009. Katika enzi ya uongozi wake aliunda kikosi shupavu kilichoshinda taji la ligi kuu ya Ufaransa miaka 10 iliyopita. Diouf alilazwa hospitalini Senegal baada ya kupata virusi hivi na ndiye raia wa kwanza wa Senegal kufa kutokana na homa ya COVID-19. Kulikuwa na mipango ya kumpeleka Ufaransa kwa matibabu zaidi mapema jana, lakini alizidiwa kiafya kiasi cha kutoweza kusafiri. Diouf aliwahi kuwa mwanahabari na ajenti wa wanasoka kadhaa mashuhuri akiwemo aliyekuwa gwiji wa Chelsea na Ivory Coast Didier Drogba. Wengineko, shirikisho la soka duniani FIFA linafanya mikakati kushughulikia mahitaji ya kifedha katika soka kutokana na changamoto za mechi kusitishwa katika ligi au mashindano tofauti kwa sababu ya janga la homa ya corona. Kulingana na shirika la habari la Reuters, wakuu wa FIFA wanakiri kwamba shirikisho hilo lina jukumu la kusaidia mashirikisho yote wanachama wake ambao yamo taabani wakati huu mgumu. FIFA inalenga kutumia kitita cha takriban dola bilioni 2.7 kutoka kwenye akiba yake. Shirikisho la FIFA linanuia kuibuka na mikakati ya namna fedha hizi zitawafikia wanachama wake, mashirikisho ya mabara tofauti na washikadau wengine katika kandanda duniani. Michuano ya kandanda imesimama kote duniani kwa sababu ya janga la corona na klabu nyingi zinapata matatizo kuwalipa wachezaji na wafanyakazi. Tayari timu kadhaa duniani zimekata mishahara ya wachezaji na kuwapa likizo ya lazima wafanyakazi wasiokuwa wachezaji. Na mtazamaji, kufikia hapa sina budi kutamatisha NTV alasiri. Kwa taarifa zaidi usikose kutazama NTV jioni na taarifa zetu kwa lugha ya Kimombo mwendo wa saa 3 kamili. Kumbuka kwamba mwenzetu Dennis Okari atakuwa akizungumza na Wakenya hao wawili ambao tuliona wakizungumza na Rais Uhuru Kenyatta ambao wamepona virusi hivyo vya corona. Kwa hivyo usikose. Na uwe na jioni njema.
This is NTV.
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain. If symptoms persist, seek medical advice.
Kiprop is going to make it. He's got another 20 yards to go with those long legs.
A 3-time world champion and a former Olympic champion in the 1500 meters, Asbel Kiprop was a global sporting icon.
Seeing your friends shy away, some you mentored them, some you competed with them.
His world came crashing down on him.
Even my own wife then did not know, what I'm going through, and she went away. I remember this is the match I built through athletics.
Kiprop is still protesting his innocence. Join Grace Musalame this Saturday from 8 p.m. on Unscripted with Grace, only on NTV.
Like you, Jesus.
This is Fact Finder from the BBC.
Obviously, the argument is that Botswana tourism makes so much money for the economy.
How has the media covered the controversy on elephant hunting in Botswana? We find out.
How can a community live with these animals despite of the challenges they are bringing?
We speak to an elephant expert on the role of media in conservation.
I'm talking to a couple of young innovators here who have developed tools for fighting fake news.
And is streaming killing the cinema industry? BBC Reality Check has been investigating.
Sonia yampenda Jabali kiasi yale wayaita mapenzi, ule wake ni wivu. Sasa mambo ya kumpenda Jabali na kumchukia huyu Fadhili yaingilia nao kwa pisini, mambo mawili tofauti.
Baba, simu yangu yenyewe ni ile wejua. Nitakesha nayo vipi na kuchaji mpaka kazini?
Jamani, mwana mrongo yuauzwa wapi muuze mimi angalau mpate pesa za kuondoa hizi dhiki.
Mara nyingine najiuliza kati ya wewe na huyu Fidhuli wako Jabali, nani bingwa wa kuudhi?
Kwani ulikuwa haulizi kuhusu sausage kuungua?
Nilikuwa nimekuulizia kuwa mvua ikinyesha huwa ardhi ya tota.
Nimekuja kuongea na wewe. Siongei na maadui zangu. Nishatangaza vita na wewe ni adui. Toka.
Hatutakuwa tukipotezeana muda rafiki yangu.
Akili yangu ina mambo mengi.